Thank you. Welcome back, and I hope all of you had this huge amount of publication that almost of all, I mean, I'm addicted to her, so to publication, so thank you for being back. And as Anya say, the topic will be gut-bone axis and just follow clinical implication. Of course, I need to introduce the concept, to introduce the plausible biological mechanisms that are behind this. So this we heard already today. Intestine is the most complex organ we do have in our body. Biochemically speaking, it's the most complex because it's got not only its own function, like digestion and absorption, but also it just carry inside the gut microbiome. Gut microbiome, we know almost everything. I mean, in the audience and the people online, we have been telling this over and over again. So we have a huge amount of live microorganisms into this intestine, and we just take the opportunity to get these, let's say, microbes work for us, because what we need is their genes, because they have a huge amount of genes that help us as humans to just exert all the functioning, not only into the intestine, but far away. So the implication that these microbes has into the body is immense. He has on the brain, we heard John before, he has got on the liver, on the heart, and of course, he's got on the bone. So that's why we just introduced the concept of gut-bone interaction, gut-bone axis. But before to go to this interaction, I want you just to remind, again, every one of us are doctor, physician, and healthcare professional. We know, we studied on the book this. The bone has got a turnover. So we have a high turnover when there is childhood, so when the bone are starting to form, to create, that we have a plateau where the balance in formation and reabsorption is achieved, and then we have a decrease in the elderly. And actually, we will focus on this. We are pediatricians, and we want to care about this effect during pediatric age. Even though, let me tell you, there are not so much study, because so far, all the study have been focused in the elderly, and especially in the menopausal age, because the women are most affected, and we will see why, especially later. But let's go and see what are the mechanisms behind this. So this gut-bone axis pathways basically relies on these different pathways. First of all, immune system, and especially the Th17 cells and the Treg cells. Then we have endocrine system. Then we have the metabolites, like short-chain fatty acid and others. And then we have the extracellular vesicles. But let's go step by step. Let's go in this immune system. We know very well, we had so much information yesterday about the regulation of the microbes into the intestine on the immune system, generally speaking. Let me tell you, that slide that I showed you at the very beginning, I just forget to say that the intestine is the immune organ number one. More than the lymph node, more than the spleen, because into the intestine are located the highest number of immune cells. So these immune cells basically are regulated and educated, I can see, by the gut microbes and their genes, remember. So they start to be educated in the submucosa, dendritic cells, lymphocytes, and other cells. They just cross the blood barriers, enter into the bloodstream, and reach all over the organs into the human body. But what has this to do with the bone? Simply, they go in the bloodstream, they reach the bone tissue as any other organs. And these lymphocytes and these cells, the Th17 cells and the Treg, just decide the action of the osteoblast and the osteoclast. So they can decide which kind of cells will be working on. And that is the concept about, we had dysbiosis. I know that these terms some people don't like, but I will still use it because it's effective in practice for me to try to explain. So if we have this dysbiosis, then we have a different training of these cells. Means that we educated different cells to produce some other kind of cytokine. And basically, this is affecting, again, the Th17 cells. And remember, these go via bloodstream into the bone and change the production of pro-inflammatory cytokine and change the activity of the osteoclast and the osteoblast. And so this is the new concept that we can just talk today, this osteoimmunology. Because altogether, the colonization of the intestine and the metabolites influence the immunity and the bone formation. And this is one. So let's go to see what are these extracellular vesicles. These extracellular vesicles are these nanoparticles. Nano means they are very, very tiny. So look at this. It's 10 to 400 nanomillimeters. These vesicles are produced by bacteria, and they are different from the gram-positive bacteria and gram-negative bacteria. These tiny sides allow this extracellular vesicle to enter the cells and to carry a lot of substances. And they can decide to transmit, they can have the possibility to transmit antibiotic resistance, the killing the competing bacteria, as you can see, the virulence factor delivery, and they are released differently, again, by different microbes. So we have the gram-negative bacteria extravesicle that exert some effect. And also we have the gram-positive bacteria extracellular vesicle that can influence inside the cells, changing the production of the genes of the protein, and they have an efficacy on the bone functioning. And then we have the third, the host metabolism. Host metabolism, we have a lot of metabolites, of course, but guess what? We will talk about our friends, short-chain fatty acid, because these are the metabolites per excellence. So short-chain fatty acids are produced by bacteria. And short-chain fatty acids have in this gut-bone axis this major role. Look at this, calcium reabsorption. We know calcium is the basis of the bone metabolism. So short-chain fatty acids have absolutely an influence in the reabsorption of the calcium. These go again in the bloodstream, reach the bones, and start the production. So short-chain fatty acid, butyrate, acetate, these are helping. And we know perfectly that every kind of dysbiosis affects the change of production of short-chain fatty acid. And the last but not the least is the endocrine system. And guess what again? We had before by John and we had also yesterday, serotonin. Serotonin is just the hormones that decide the gut-bone metabolism. Where is produced serotonin? Into the intestine, exactly into the crypt of the epithelial cells, where the colonization is completely different by the one in the lumen. So we just change this colonization of the crypt, we have an effect on the concentration and secretion of serotonin. And so that is the third. But let's go, this is just a recap. We have the fermentation, we have the microbial differentiation, and then we have the difference in increased short-chain fatty acid concentration. We go into the bloodstream on the immune cells, and we just go directly to the pro-osteoclasts that change the apoptosis and inhibit the osteoclastogenesis. So this is a recap. Just to keep in mind that the complex mechanism is basically due to this change of colonization. But we know also, and we heard, that the colonization of the intestine is absolutely changed by the micronutrients and also supplementation. So we have different action on prebiotics, probiotics, or other metabolites. And who is changing this? Basically, nutrition. So we change our nutrition and we change the concentration and changing of the colonization. But don't forget the second part of the title, clinical implication. So what we have in our end to change this. We have, we heard yesterday, dietary intervention, exercise, kind of style of life, and also supplementation that can reflect on the bone metabolism. But let's go to see what is written in the literature. Of course, there are a lot of studies showing how this prebiotic supplementation can change the production of short-chain fatty acid and can have the main effect on the bone. Basically, these studies are preclinical study on animals. So there are a lot. Look at this. So we have different kind of dietary supplementation or lactulose or resistant starch or oligosaccharides. And look at this. Only very few studies in humans. And on all these studies in humans, basically there are on adults, on elderly, on women in premenopausal or menopausal status. These are the list of all the study on probiotics. And again, look at this. More in animals, less in human, and again, almost adult. But then we start to say, okay, we have some effect, for instance, of the Reuteri on premenopausal woman. But let's see, if we put the prebiotic on the adolescent girl, do we have some efficacy? And they start to think out of the elderly, out of the menopausal. And then it comes this nutrition and intervention in children. This is a very nice study published by the group of Jeffrey Gordon on PNAS, where they just check these malnourished children in Bangladesh. They treat these children in acute malnutrition with this therapeutic food, and they showed that there was a reduced plasma level of biomarker of osteoclastic activity without influencing the osteoblastic activity, and also improving, and either not improving the stunting. Then, with this, what they do, this group of scientists, they make the fecal transplantation of these children in the animal. They had a bovine HMO, and they show in this animal that there was an increased femoral trabecular bone volume and the cortical thickness. So the effect on the reabsorption and, let's say, construction of the bone was efficacy. But this is something that has never been repeated. But then it came the study in children. So this, so far, it's an abstract that has been presented in the ESPGAN last year, and it's a randomized double-blind controlled trial performed in the Philippines, where a group of children of 2 or 3 years of age received formula containing a symbiotic, means Lactobacillus reuteri DSM 17938 and GOS, and or a standard formula. So these children were consuming this product, and they were checked for the effect on the bone. And so these are the results. So the tibia speeds of sound average, it's just better and more thickness in the children who were receiving this specific formula with the symbiotic. So what the study conclude that this consumption of a young child formula containing this symbiotic improved the bone quality, the bone strength, but these children were healthy, not malnourished. So this is something that start to just face. And then the last is this fecal microbiota transplantation. Of course, these are studies in animal. And what they show, they just took this germ-free rats and they transplant the fecal, some fecal microbiota, and just they check that there was a reduce bone turnover in osteoporosis. Remember always that the major focus is in premenopausal or menopausal. But remember also the first slide I showed, we have this area where we are in charge. So the beginning of life, pediatric age, where we do need to just give the children a chance to control and to construct their bone. So what are the conclusions? That there are evidence that the gut microbiota affects skeletal homeostasis, changing in host metabolism, immune system, endocrine, and hormone secretion. That any therapeutic intervention with dietary supplements such prebiotic, probiotic, postbiotic, and synbiotic should need to be explored and to have some more evidence for help us in the management of bone metabolism and gut-bone axis, and help these children to have a stronger bone. I thank you very much, and I hope to stay in time and answer to the question.
Flavia, thanks a lot. I invite Jose to join us for the Q&A session. And I remind again everyone that there is an option to ask questions also online for our online audience. An important topic about gut-bone interaction, gut-bone axis. We did not talk about that in previous years, so it's definitely something very new. And I am sure there are many questions, and as soon as Jose joins us, we will start our Q&A session. Flavia, be ready. Be ready.
Yeah. Ready.
I'm opening it as well.
Muito obrigado.
And if there are any questions from the audience?
There.
Yes, there is one question. Yes, please. Can you give a microphone to a lady, please?
Yeah.
No, you
Do you have one?
Oh, here is a lady from the audience. Please introduce yourself. We need another microphone because this one is not working.
Entro.
Anyone help? No, to the lady.
Hi.
Yeah.
Excellent.
My name is Yvonne Dapremon. I am from Chile, and I am a neonatologist, and I prefer to make the question in
Spanish. No problem.
Okay?
Hola, habla, no te preocupes.
Flavia speaks all.
Yes, of course. Flavia speaks all.
Mi pregunta es,
My question refers of the preterm children with a high diagnosis of osteometabolic disease when they are in the period of follow-up. Do they increase of the alkaline phosphatase, the one that receive the supplementation, the milk fortified and D vitamin in normal levels? What is the recommendations, nutritional recommendation, especially during the first semester for the post-liberation of that? That is a very complex question, and I will try to reply. What happens that in the premature newborns of the microbiota as a supplementation of GOS and others, it is not a problem of the alkaline levels, but of ensuring the practice of the obtaining a stronger bone. And that is something that we are going to do in the future for the newborns, babies.
For those
Yeah. The doctor just asked about the possibility of the preterm children because they have a very high level of alkaline phosphatase, and with breastfeeding supplementation and vitamin D supplementation, they thought that everything will go fine. And I answered that so far there are no studies on premature children about supplementation of symbiotic or probiotic or postbiotic in the gut bone. And this is possible a future research.
Thanks a lot.
Yeah.
Jose.
We have a question here. Would you would you need long-term probiotic use to achieve a lasting bone health gut? Or what can be done to achieve a better microbiome?
Thank you very much for this question. It's an interesting question. As we don't have enough study, we don't have at all long-term effect study. But this could be an option. Yes, if we do supplementation, don't forget that or any supplementation could influence the epigenetics of this. So we just give an imprinting, so maybe this could have an effect also later in life, but there is no evidence so far.
Flavia, can I just follow this question? And if you are thinking about the designing of such a study, what, in your opinion, would be the primary outcome? What should be the primary outcome in the clinical? Because we have a clinical implication.
Yeah, clinical implication, for instance, could be like the level of alkaline phosphatase in a very short term, and then later...
But this is not a clinical, it's more...
Clinical. Clinical may be the final height or I don't know, how can I say, the predisposition to have fracture or other disease.
And
later.
how long you think the follow-up should last? Because it's easy to say we need studies with a longer follow-up, but we never define what does it mean, and when we have enough evidence to say, well, it works, it doesn't work.
For sure, we should just follow the children at least until the adolescence, like 14 years of age, like a cohort, and create a cohort maybe, as Erika Isolauri did it, for the older age, as the colleague asked.
So just one more comment. This kind of follow-up studies, long follow-up studies, are not easy to perform because we are saying longer follow-up, but in real life, it's extremely difficult. So every now and then, we have to rely on evidence which is not of the high, robust evidence.
Absolutely.
Jose.
There's a question here about vitamin D and immune system and microbiome. Is there any relation?
This is a very interesting question. There are recently a lot of studies just underline that the vitamin D is not only a vitamin involved in the bone formation or rachitism or whatsoever, but is absolutely involved in immunity. Actually, now we start to call hormone D instead of vitamin because the effects are multiplied. So they change, together with the microbiome, the regulation of the immune cells into the intestine, enhancing the effect of some microbes. So yes, there are absolutely efficacy in the vitamin D in immunity.
There's another question here. Is there any brain-bone axis bypassing gut?
Bypassing the gut, not that I'm aware. Maybe John could help in this. No.
Okay. But there's an axis brain-gut bone, for sure. How does early life antibiotic exposure from birth to adolescence affects the gut microbiome and will influence bone mineral density in later life?
Absolutely, it's a good question. Of course, everyone knows that antibiotics have an effect on colonization, and these effects are also in long-term effects. So it doesn't remain only in that period of the antibiotics is administered, especially if this antibiotics is taken into the neonatal period. So, and of course, that will be also an effect on bone. And there are, again, some studies showing this, but again, the power of these studies is not so strong because we do need a lot of number of patients to be included in this.
Is the quantity of probiotics in infant formulas enough? Do you need to have more dose for babies?
Okay, this is a very good question. Generally speaking, every probiotic or prebiotic or symbiotic has a dose effect. In fact, if you go back to the definition of probiotics, is when a live microorganism subministrated in an adequate dosage. So, if we think of the concentration of this into the formula, generally it goes over the required amount. It's more. And it's been shown that if we go more in the dosage, there is no side effect.
Okay. I have a personal question.
Please.
We're living a new era of HMOs. Is there any study about this in adults or adolescents? Because I know that, for example, in the States today, you can buy in any pharmacy, you can buy 2FL, and I don't know if it's effective to use it.
Do you mean on the gut-bone axis? Yeah. Not there, that I'm aware. Not, I mean, there's no study that I know for the moment.
Okay. Well, that's the same question that I made here. And can you can you expand about the role of HMOs in enhancing the calcium absorption? You just answered now. Will recent dietary changes, vegan or gluten-free diets in young individuals, impact future bone mineral density through alterations of the gut microbiota?
Yeah, this is a very interesting question. And of course, gluten-free diet and vegan diet, they alter the microbiota. Especially, I will focus on gluten-free diet because I don't want to go in this politically incorrect story about vegan or vegetarian. Regarding gluten-free diet, of course, if the gluten-free diet is not needed because of celiac disease, of gluten sensitivity, there is a disruption, a severe disruption of the colonization, and of course, this is affecting every organ that are related to the intestine. Again, there are no specific studies showing this, but this what always we say, don't use specific diet if there is no need or a specific diagnosis.
There's a question here, I'm going to complete with, how long does it take the microbiome to be approximately regenerated after antibiotics?
Yeah. This is something that it's really not really known. This is called it because it depends on how resilient the intestine is. This. So this resilience, that means to be back at previous colonization, could change from 2 weeks to 2 months. And but for sure, what we know that the effect of disruption of colonization just is lasting for years, especially again in the newborn.
Excellent talk.
Thank you.
And the topic too. From African and Asian point of view, vitamin D synthesis is an issue. Is there any proof whether these microbiotes help in vitamin D synthesis?
For the vitamin D synthesis, it's for the sun, okay? And we know now that there are the black people has got this melanin layer, and Asian people, they cover themselves, they use blockage. So the microbiome have some efficacy, have some influence, but mainly is not due to the microbiome. Main synthesis of vitamin D is not due to microbiome.
Is the formula supplemented with the symbiotics good enough for very child's bone development? A formula, well, he wrote here in Portuguese, so that's the question. This
formula is shown with one study only. So as Anya says several times, we need more study.
Okay. And also, I think when we are speaking about any kind of synbiotics, we really have to know which probiotic was used, which prebiotics were used, and there are different approaches.
Exactly.
Yeah.
Sometimes it was just a mixture just like that, and more modern or more appropriate approach is that both symbiotic or HMOs with prebiotic effect and specific probiotics are being chosen. And then we look at the effect. And again, I would come for this particular, which outcome would be of interest in the context of gut-brain axis, because
gut-bone axis.
Gut-bone axis.
Again, it's something
In
that
the context of infant formula, let's
in
say,
the
if we
context
want,
of
because they are
infant
not so
formula,
specific.
yeah, because when you help, actually, this supplementation of symbiotic, as you say, that we need to identify precisely which kind of pre, which kind of pro, it's something that could help maturation of the colonization. So the efficacy will not go straight ahead on the gut bone, but generally speaking, on the maturation of the colonization and on the well-being, let's say, generally well-being.
We have time for more?
Yes, we do still have at least 5 minutes.
Okay.
Is there
well.
anyone in the audience who would like to add to the discussion? I'm looking here. No, but I think we still have some questions here online.
In the short stature, patients with GH deficiency, is it any studies about the microbiome and the GH use?
For the hormonal deficiency, GH deficiency is a chromosomic disease. So, and it's something that cannot be regulated by the microbes. Maybe I'm not aware that there are any study on the short stature and GH deficiency specifically and the microbiome.
Does microbiome have any relevance to the bone health of women and developing bone disorders?
Absolutely, yes. The majority of the study are on women, on premenopausal, menopausal women. Yes, the answer is yes. That's why I'm supplemented every day. All women, menopausal women.
TH17 has beneficial and determinal roles on gut functions and gut immunology, with microbiome regulating the balance. It is known if it's the same in bone.
Yeah. The TH17 cells are the major cells involved in the gut-bone immunity axis. Yes.
Okay. Any relationship in gut-bone axis and rickets in infants?
No, because rickets come from vitamin D deficiency, so no.
There is a lot of questions during this session on vitamin D. It seems like the topic to be discussed at one of the workshops now, and I'm looking at the questions.
Vitamin D, definitely.
How do negative around D3 when patients has displayed intolerance?
I don't understand this question.
Neither I.
How to integrate, how to navigate around vitamin D3 when patients has displayed intolerance. Sorry.
Display intolerance of what? Of vitamin D? I don't understand. I'm sorry, I cannot answer if I don't understand.
If the person who asked this question could type it again, perhaps it would be easier for us to understand. Sorry, we apologize.
How childhood illness impact the development of a healthy microbiota, and how does this affect peak bone mass and the risk of osteoporosis in adulthood?
Yes, what the question is about child disease, it's too general. For sure, any disease has got any effect on a microbiome. Any therapeutics can affect any kind of colonization. For sure, we have to ensure always a proper colonization in order to, as I said before, this well-being included the gut-bone communication.
There is another question here. I think we have time for this one.
One last
the last one.
Two, maybe even two.
Maybe two. How can the interaction between gut microbiome and bone homeostasis, particularly in calcium absorption, be leveraged to prevent sarcopenia after in life?
Yes, as I told you, the main role of this calcium absorption is due to the short-chain fatty acid. And of course, we know that the more calcium we absorb in the very early stage of life, the more we have later. And yes, so short-chain fatty acid is a fantastic role in this. And also this is important in the children that are malnourished. And yesterday we heard Sid to talk about this, so microbiota has a role also in this, definitely.
There is a question here about inflammatory bowel disease. Intestinal inflammatory disease is in pre-adolescents. Use of probiotics and gauze to improve the bone improvement. Is it available?
Unfortunately, I can say that there is no evidence of any use of probiotic in inflammatory bowel disease, even though these children affected by inflammatory bowel disease have got a lot of problem in stature, in bone reabsorption, and so far and so forth, because there is this leaky gut that even though this sentences, this definition is not liked, we can say cracked and disrupted or whatsoever, but use of probiotics in IBD has shown no efficacy.
One more?
Last question.
question.
Short
Last
question,
okay.
short answer,
There's a
please.
is there any relationship between microbiome and gastritis in children? Can probiotics help children with this type of gastritis?
Which kind of gastritis?
I think it's peptic, you know?
Which-
Peptic for
ulcer.
acid, yeah.
Ulcer. Peptic ulcer or Helicobacter
Yeah.
pylori infection, or
Yeah.
I don't know. There is a lot of gastritis.
Gastritis, yes, gastritis.
So about probiotics in acute gastritis, like peptic ulcer, there is no evidence. What I can answer is that probiotic in the children that has got Helicobacter pylori infection and underwent to this therapy of Helicobacter pylori infection, probiotics have an efficacy in reduce the antibiotic side effect of the therapy.
I think
We are
that's
done? I think
we are done.
We are done. Okay, thanks a lot. Thank
Thanks
you
so
very
much.
much. We don't have time for more questions.